Hi, I'm Dr. Daniel Sadowski, and I'm a urologist here at Rockford Urological Associates. And I would like to talk with you today about recurrent urinary tract infections because this month of November is National Bladder Health Awareness Month. So, recurrent urinary tract infections are a relatively common problem, especially amongst women. And as a urologist, we like to first confirm with a urine culture that these are truly urinary tract infections and not based off of just a quick dipstick urinalysis. Because sometimes people can have symptoms like feeling like they have to go pee often or urgency, burning with urination, but it's not actually an infection to explain that. So we like to base it on a urine culture. Then, as part of the workup, we sometimes may obtain imaging or perform a cystoscopy, which is taking a look inside the bladder with a camera. If all of that's normal and they are culture-proven infections, then I often provide general recommendations, which include drinking a modest amount of fluid, 60 to 80 fluid ounces a day for most people, and then exercising timed voiding and double voiding strategies. And this means going to the bathroom every 2 to 3 hours to keep your bladder empty. And double voiding is where after you're done going to the bathroom, you wait a moment and then try to empty your bladder again. I also say that happy bowels make for a happy bladder, so I encourage bowel management with stool softeners to have a daily soft bowel movement. And you can also take probiotics, which promote healthy gut bacteria, which may reduce that risk for urinary tract infections as well. For ladies, as we age, the tissues can become weaker, and a vaginal estrogen cream may be recommended if there is vaginal atrophy. And that medicine is applied to the area around the urethra. It can bolster healthy tissue, and that one has been proven to reduce infections. Another option is taking cranberry tablets. I typically recommend the cranberry tablets over the cranberry juice just because it is difficult to consume the volume of cranberry juice that's required in order to get the active ingredient at a high enough level to really prevent the infections. And a final point is if a patient has diabetes, then I recommend good diabetes control because that would also help prevent these recurrent urinary tract infections. So these are some general recommendations, some thoughts about recurrent UTIs. And of course, if you have any questions, you should get in touch with your primary doctor, or you could call our office to set up an appointment. All right, well, I thank you for your time and attention.